Hi, I'm Leonard Lopoo. I'm a professor in the Maxwell School in the Department of Public Administration and International Affairs, and I'm going to speak with you today about the eugenic origins of federal family planning policies in the United States. This is a part of a book that I've just written that is available now called Wanting Children, Family Planning Policies and the Engineering of America's Population. I'm going to discuss today roughly the first third of the book. What I hope to do in our conversation is to first define what family planning is, and then I'm going to describe what family planning in the United States as subsidized by the federal government actually means. There are a couple of reasons that the federal government provides family planning, and I'm going to discuss the traditional explanation that's offered. But part of what my argument is for the for the family planning programs is there's a part of the story that we've never really discussed, that our studies, that people who think about this don't really bring up as often, and that I'd like to add to the conversation. And that is that we have a eugenic history, and that history has played some role in the development of these policies across time. As evidence of my argument about the additional role that eugenics has played in family planning, I'm going to go back in time to what I call the population stabilization period, which is roughly during the Nixon administration. And I will walk you through why I believe that eugenics played a much broader role than is often discussed. The final thing that I'd like to do is provide for you some evidence from what Americans think about family planning policies in the United States, both those that currently exist as well as those that potentially we could have if we thought about family planning more broadly. So that's my goal for our conversation. So let me start by defining what family planning is. The World Health Organization, and there are many international organizations that have literally the exact same definition or something quite similar, would say that family planning allows people to attain their desired number of children and to determine the spacing of pregnancies. And that the way that family planning operates is both through contraceptive methods as well as the treatment of infertility. Now, this isn't too different from what you would see if you were to gather information from what's now called the reproductive justice movement in the United States. The reproductive justice movement started in the South at the grassroots level among Black communities, where they said that reproductive justice really means that every woman should have the right not to have a child, should have the right to have a child, as well as the right to parent in safe and healthy environments. And I don't think that there's anything terribly controversial about that. That's, again, largely the way that family planning is defined internationally. But in the United States, we don't think of family planning exactly the same way. In the United States, we probably would only include the first part, up until the point that I have bolded in my slide. We would say family planning allows people to attain their desired number of children to determine the spacing of pregnancies, and that it is achieved through the use of contraceptive methods, full stop. That's the way that we think about family planning in the United States. That's certainly what's currently in our federally funded family planning programs. The treatment of infertility is not part of family planning that's provided by the federal government. Now, you may say, how many people does that affect? What are the rates of infertility in the United States? Is that a big group that's not really incorporated in our family planning policies? Here's the most recent data on infertility. This is a table that shows you the percentage of married or cohabiting women between the ages of 25 and 49 who are infertile. And I've provided this by race and ethnicity. The definition of infertility, and these are data that are collected by a federal agency. The definition of infertility is a married or cohabiting woman who has, clearly has a partner, who has unprotected sexual intercourse at least once a month for 12 consecutive months. If that individual does not become pregnant over that time, they're considered infertile. And you can see in the table that about 8.5% of all women meet this definition of infertility. but it's not consistent across racial or ethnic groups. Black non-Hispanic women, for example, tend to have infertility rates that are much higher than the average woman in our population. And I think that that's important. We'll return to that issue later in our conversation. I can also break this down by the education level of the individual who's been surveyed. Again, these are all women. You can see that the higher your education level, the less likely you are to be infertile, with the exception of those who have a master's degree. Those who have a master's degree tend to be older, which also creates more difficulty becoming pregnant. So if you look at the infertility statistics in the United States, what you find is a lot of women actually are infertile, maybe about 8.5% of them, but that among the women who are infertile, the lower your education level, the more likely you are to be infertile. Also, if you are a black woman, for example, in the United States, you're also much more likely to be infertile. So the people that are excluded from family planning in the United States, when we exclude infertility, are more likely to be, again, people with low levels of education and certain racial or ethnic groups. Now, this actually becomes extremely important once we think about what the federally funded family planning in the United States looks like. There are actually a large number of family planning programs, some at the local level, some at the state level, some at the federal level. The two biggest family planning programs in the United States are something called Title X, which is funding to provide assistance to healthcare clinics. The second, and the larger of the two federally funded family planning programs, is the Medicaid family planning program. Medicaid family planning, as I'll talk about in a moment, was added to the original Medicaid program, and it's hard to know the exact amount of money spent on it because the family planning component isn't actually directly taken out of the overall spend, but we know that there's actually quite a bit of money spent on family planning through these two programs. Again, these are our two biggest. Now, importantly, these programs only cover contraception and reproductive health services. Reproductive health services include things like well woman visits, cancer screenings, and the other medical care that one might need in order to get contraception. So the contraception is being provided federally, as well as the reproductive health services, but there is no component to these family planning programs that provides infertility treatments. Again, an important point that is a part of the story that I'm telling in my new book. These family planning programs only target low-income women. So low-income women, we offer contraceptive services to. We do not offer infertility treatments. So that has led sociologists Leslie King and Madonna Harrington Meyer to say the effect of our U.S. family planning is essentially a de facto fertility policy that discourages births among poor women and in some ways encourages birth among working and middle-class women. There is some unfairness here. I think if one took a step back and thought about what family planning is in the U.S., you'd say, if a low-income woman does not want to have children, we will subsidize this assistance to help that woman from having a child. But if that low-income woman wants to have a child, there is no equivalent infertility treatment that's available. Now, there is an explanation for this that's offered that is quite important and reasonable and well understood, and I would say I'm a strong believer in as well. This is the notion of health equity, that family planning, so let me start by defining what health equity is. Health equity means, this is a definition by Braverman and colleagues, health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. So the notion here is, if a middle-income woman has access to contraception, which they do, and uses contraception to time their childbearing so that they can take advantage of the opportunities that are available to them, completing an education, starting getting married perhaps, or starting a partnership, or starting their career, working before they start having children. You want to give people control of their fertility. And if that's available to women in the higher ends of the income distribution, that should also be available for women who don't have the resources to purchase contraception. Again, a very valid, believable, reasonable, and important justification. And many people who work in this space, who created this legislation, were strong health equity proponents, and they were right to be health equity proponents. Here's a quote from Alan Guttmacher. Some of you may be familiar with the Alan Guttmacher Institute. It's a think tank that studies reproductive health issues. Alan Guttmacher, back in 1958, he used a health equity justification when he said, New Yorkers who can afford the services of a private physician or private hospital have no difficulty in obtaining competent instruction in contraception. I wish to speak behalf on the thousands of women who are discriminated against in our great municipal hospitals by this prohibition. Must this type of backward medicine be perpetuated? Again, in the 1950s, long before these federal programs were even created, there was the notion that we need to make sure that low-income women have opportunities to control their fertility so that they have access to labor markets and education that wasn't that had become newly available to them. A very important argument. Richard Nixon himself said to Congress in 1969, "It is my view that no American woman should be denied access to family planning assistance because of her economic condition. I believe, therefore, that we should establish as a national goal the provision of adequate family planning services within the next 5 years to all those who want them but cannot afford them. This we have the capacity to do." So first, I want to note, again, this notion of health equity. It was very important. A lot of people were pushing for family planning available for low-income women to make sure that they had the same opportunities available that middle-income women, that more affluent women have. I do want you to note that Richard Nixon said this in 1969, because I'm going to return to Richard Nixon in a later point in our conversation where President Nixon actually wasn't speaking publicly to Congress. He was actually speaking privately in his office. And there you'll see his rationale for family planning seems to be a little bit different. So I will point that out when we get there. Now, before I offer a new explanation or an additional one, I don't think this is the only explanation. I just think that we have never really considered the influence of eugenics that when we created these family planning policies, and I think it explains a lot of what they look like today. So if I could stop for a moment the family planning conversation and just spend a little bit of time making sure that everyone is familiar with what eugenics are and some of the history behind eugenics in the United States. So to begin, eugenics, a term coined by Sir Francis Galton in the late 1800s, when he created this term, he literally meant he wanted to have the definition that it's good in stock, hereditarily endowed with noble qualities. That's what eugenics meant. Basically, Galton said in his writings at the time, I look around the urban areas that I live in England, and I see many people of, again, the language that Sir Francis Galton uses, and I'm going to move into a part of my conversation where I think some people may find some of the language that was being used in the past very objectionable. So I just want to make some warning that a lot of what we'll discuss when we describe eugenics, people are going to say things that I think could be very offensive. So what he meant by eugenics was that I see a lot of people that I consider inferior having lots of children, and I see a lot of people in my class, the class that I consider superior. He used the language of superior races. I see a lot of the superior races not having as many children. And his concern was over time, if you see a lot of childbearing among those classes that he considered inferior, and not much childbearing among those classes he considered superior, you're going to have a population composition over time that concerned him. He described two forms of eugenics. The first was positive eugenics, and positive eugenics to Galton was the idea that the superior races, again his language, the superior races should have more children than they currently are having. The other way that he said that we can have a population composition that he was more comfortable with was something he called negative eugenics. In negative eugenics, he meant that inferior races should have fewer children. And I think it's negative eugenics that most people are familiar with when they hear the term or when they read about eugenics. It's this notion of negative eugenics. During the early 1900s, the idea of eugenics crossed the Atlantic into the United States and became very common among the political and intellectual elites. Many universities across the United States offered a class in eugenics. Harvard University, Cornell University, University of California, Berkeley, all had classes in the notion of eugenics. Every United States president, from Theodore Roosevelt to Herbert Hoover, had a strong affiliation with eugenics. This is a quote from President Theodore Roosevelt in a letter that he wrote discussing eugenics. He wrote, "I agree with you that society has no business to permit degenerates to reproduce their kind. Someday we will realize that our prime duty, the inescapable duty of the good citizen of the right type, is to leave his or her blood behind him in the world, and that we have no business to permit the perpetuation of citizens of the wrong type." This thinking was not uncommon in the first half of the 1900s. This sort of thinking was openly acknowledged and was promoted consistently. In fact, the law of the land actually allows for eugenics. In 1927, the Supreme Court decided in Buck v. Bell that the 1924 Virginia Sterilization Act they found in favor of the act. The act allowed for involuntary sterilization for what they called, again at the time, feeble-minded individuals, or people with cognitive limitations, epileptics, and a variety of other people, and that the sterilization was allowed without due process. The court found 8-1 in favor in Buck v. Bell of this eugenic act. And there were a lot of people who wrote for the majority. Former President William Howard Taft was on the court at the time, as was Louis Brandeis, two very well-known, of course, public figures. Perhaps one of our most famous jurists of all time, Oliver Wendell Holmes, wrote for the majority in that decision. "It is better for the world if, instead of waiting to execute degenerate offspring for crime, or to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind." Now, by the end of World War II, 20 states had eugenic laws on the books. Those laws ranged from the sterilization of a variety of individuals to forbidding marriage in certain places to prevent childbearing. We know that at least 60,000 people were sterilized in the United States in the early 1900s as a result of this eugenic way of thinking. Now, following World War II, eugenics became a very taboo subject with the revelations of the Holocaust. There's also a lot more understanding of genes and the transfer of genes. And so eugenics has sort of fallen out of favor. Again, it is certainly a taboo subject, but it's not unusual, even today, to hear people express things in a eugenic manner. For example, in October of 2024, Donald Trump, who at the time was a presidential candidate, said on a radio show, "How about allowing people to come to an open border, 13,000 of which are murderers? Many of them murdered far more than one person, and they're happily living in the United States. You know, now a murderer, I believe this, it's in their genes, and we got a lot of bad genes in the country right now." Again, connecting genes and behavior a very eugenic approach. You can also see Elon Musk, who, to my knowledge, has at least 18 children as of this date, said to his biographer, if each successive generation of smart people had fewer kids, that's probably a bad thing too. I mean, Europe, Japan, Russia, China are all headed for demographic implosion. And the fact of the matter is basically the wealthier, basically wealth, education, and being secular are all indicators of low birth rate. They all correlate with low birth rate. I'm not saying like only smart people should have kids. I'm just saying that smart people should have kids as well, that they should at least maintain, at least be at replacement rate. And the fact of the matter is that I notice a lot of really smart women like have 0 or 1 kid, and you're like, wow, that's probably not a good idea. This would be a very positive eugenic form that I want to see more of the sort of people that I'm talking about have more children. So even today, some of this eugenic sentiment is becoming more common in a variety of places. So if I could return back to contraception now that we've had some discussion of eugenics, I'd like to connect contraception and eugenics, which was very much driving a lot of the development of the contraceptive technologies. Margaret Sanger, many of you may be familiar with Margaret Sanger. She was a women's rights advocate. She was the founder of Planned Parenthood, and she was instrumental in the development of the oral contraceptive, or the birth control pill. She, in combination with her benefactor, Catherine McCormick, worked with the Searle Pharmaceutical Corporation to create what, again, we now call the birth control pill, the oral contraceptive. And she wrote at the time what her motivation was for these contraceptions, this contraceptive development. I consider that the world and almost our civilization for the next 25 years is going to depend upon a simple, cheap, safe contraceptive to be used in poverty-stricken slums, jungles, and among the most ignorant people. I believe that now, immediately, there should be a national sterilization for certain dysgenic types who are being encouraged to breed and would die out were the government not feeding them. Dysgenic is a term meaning bad genes. This sentiment is going to surface again and again, that there are people who are having lots of children and the government is supporting them, and that were it not for government, then the government is actually sort of part of the problem of why we see some populations that they want to see fewer of. So let me just take a moment to kind of summarize where we are in my argument. It's the case today, as it was when we first created these programs in the 1970s, that only low-income men and women can receive contraceptives supplied by the U.S. government. Again, these, I'm not sure I mentioned earlier, you can receive these supplies at no cost if you qualify for the programs. That the justification, and rightly so at the time that was made, was a health equity one. If middle income, affluent men and women in the United States have access to these to control when they have children, then low income women should have access to these things as well. That is the argument that you would hear at the time, as I'll show you in a moment. That is the argument that you would hear from most people today about the importance of this particular set of programs. I myself would agree that this is an incredibly important and valuable reason for us to offer contraceptive services. I've also explained that the rest of the world defines family planning to include infertility treatments. That is not the case for the United States through our federally funded family planning programs. We do not have any infertility treatments. That modern contraception was originally developed around the time that these programs were created to stop dysgenic types from having children. And I also want to make an important point that today there are lots of infertility technologies available. By the way, there were lots of infertility technologies available in the 1950s before these family planning programs were created. Ovulation stimulating drugs, for example, have been around for a very long time. If health equity really was our goal for family planning programs, as more and more infertility technologies, again, ovulation stimulating drugs, in vitro fertilization, as these technologies have become available to middle income and more affluent women, health equity would suggest that we offer these services to low-income women. If that was truly our goal, we actually don't see any of those offered to low-income women. So I'm going to go back in time and discuss the actual history, what was occurring in the United States when these family planning programs were created. And you'll see that there's no question health equity was part of the arguments that were being made to create these programs, and as I've said many times, rightly so. But you're also going to see that a lot of what we would, what I recognize as eugenic language and eugenic justification was also part of some of the thinking at the time. Today, no one thinks at all about or brings up at all this eugenic argument as at the time that these programs were created. But I think the evidence suggests not only was health equity in play, but that some people had much more nefarious goals when they created family planning that only allows contraceptive services. So if we can go back in time to 1968, I want to start with a book written by Paul Ehrlich called The Population Bomb. The Population Bomb describes a world where our populations are growing so rapidly that our food supply is not able to keep up. And Ehrlich describes a world in which there becomes civil unrest as there are more and more people and there are fewer and fewer resources to take care of those people, that eventually leads to a lot of chaos and a lot of sort of social, again, unrest and a lot of things that we should be very, very concerned about. Paul Ehrlich not only was an academic, he was actually his book crossed over into the mainstream. There are a lot of, he made a lot of appearance in popular media. He talked about this story quite a bit, how our population was growing too rapidly. In fact, he was on the Johnny Carson show, which was a very popular television program at the time, at least 18 different times discussing this issue. So this was not just an issue that people who study populations were thinking about. This was an issue that the average American understood in 1968, that our population is growing really, really rapidly, and there was some concern. This information eventually made it into the political arena. In 1969, President Richard Nixon wrote a message to Congress expressing his concern that the United States population might exceed 300 million by the year 2000, and that this would generate a host of social problems. By the way, he wasn't that far off in his projection of our population in the year 2000. While all of these conversations were occurring, the three most influential population policies that the United States ever created were set in place. In 1970, the Title VII of the Public Health Service Act was created, the Title 10 that I've already described for you earlier. In 1972, we created the Family Planning Services and the Medicaid program. And then in 1973, Roe v. Wade, which legalized voluntary abortion across the United States. 5 states, by the way, had already legalized abortion starting in 1970. So you can see something was happening at that point in time, very focused on population in the United States, and there was a lot of concern of the rapid growth in our numbers. Now, I'm going to start to go back in history and look through documents and try to understand what people were thinking. The first place that I'm going to start is a commission that President Nixon created in 1970 called the Commission on Population Growth in the American Future. He asked a panel of experts to study the population issues as I described in the U.S. He was very concerned about our rapid growth. It was headed by John D. Rockefeller III, who was the grandson of oil tycoon John D. Rockefeller, and included a number of politicians, physicians, and academics. Now, I'm going to go back through their report because they make a lot of recommendations, and I'm going to read their language. What was their justification for the population changes that they encouraged? Again, a lot of legislation was happening right at the same time. The commission wrote, after 2 years of concentrated effort, we have concluded that in the long run, no substantial benefits will result from further growth of the nation's population. rather that the gradual stabilization of our population through voluntary means would contribute significantly to the nation's ability to solve problems. We've looked for and have not found any convincing economic argument for continued population growth. The health of the country does not depend on it, nor does the vitality of business or the welfare of the average person. So again, at the time, we're growing very rapidly. The commission says there's no reason for us to continue to grow. We need to start stabilizing population. We need to start thinking about population control. Again, you see the legislation that results. Now, what's some of the recommendations from the commission? To eliminate all legal restrictions to contraception, and that includes for minors, that abortion be legalized nationwide, which of course it was. And the justification that was offered was equality of access. A quote from the report, and this speaks to abortion. Medically safe abortions have always been available to the wealthy, to those who could afford the high cost of physicians and trips abroad. But the poor woman has been forced to risk her life and health with old remedies and disreputable practitioners. So again, very much a health equity argument. We need to start controlling populations, and the reason that we should do that is because these technologies are not available to low-income women. So that's where we should target our family planning programs. And if you continue to read through the report, there are lots of interesting passages like the one that I've got, this particular slide, which sort of goes back and forth, interestingly to me, to say minority populations do not have enough children for us to control populations. Yet at the same time, they call constant attention to the high rates of fertility among the minority populations. It's very interesting. This is the particular group that they're focusing on. They're saying minority populations have lots of kids. Now, if we want population to stabilize, this isn't the only group that we can focus on, or this isn't the group we should focus on. But they called attention to them over and over again. Again, reading between the lines, that seems quite suspect. But I don't think you even have to read between the lines to see some concerning language and ideas that are being expressed in addition to health equity. Here is a quote from Dr. Eugene Callender, who was the president of the New York Urban Coalition. This was actually in the report as well. When asked about what do you think about population control and how will some disadvantaged populations think about this, Dr. Callender said, within this country, blacks, Indians, Chicanos, Puerto Ricans, and Orientals feel that such population control is solely to the advantage of the majority population. Minority groups at this point in history do not feel that they can afford to trust that the nobler instincts of the white majority will prohibit the resurgence of subtle and overt forms of racism. So at the time, this notion of population control was very concerning. That who is it that you're going to focus on? Why is it that you're actually creating these services, and you're making them available at no cost to the low-income populations? But you don't even have to, again, read these reports and try to make inferences. There's actually some pretty direct evidence of what people were thinking at the time about what they meant by population control. What I'm going to do next is I'm going to play for you a very small snippet of President Nixon in the Oval Office speaking to his domestic policy advisor, John Ehrlichman. They were discussing the report. Again, there's about a 6-minute period on the Nixon tapes, right? So probably many of you are very familiar. President Nixon recorded most of his conversations in the Oval Office after some point in time. Once the report was delivered, Ehrlichman brought it to Nixon and asked him what he wanted to do about the recommendations that are in the report. President Nixon at the time said that he was not in favor of a lot of the recommendations, particularly as they pertain to abortion. But what I want to play for you is not their policy conversation. I'm going to play for you a small snippet of their conversation about their own opinions on what the population control they were really interested in. So again, the audio isn't perfect here. This is President Nixon. He will start, and then he and John Ehrlichman will go back and forth.
I know what we're talking about, population control. population in the city of San Francisco has gone from 3,000 right after World War II to where they represent 30% of the population of San Francisco. Yes, sir. Monstrous white flight. Sure. And burgeoning black population.
So the reason I wanted to play the audio for you is I think there's a couple of things that you can tell from their tone that I think is quite revealing. First, after President Nixon says the people who don't control their families, Ehrlichman immediately goes to the black population, right? So they seem to be thinking or talking about who exactly, what he meant by the people who don't control their families. Ehrlichman went directly to the black population. The second thing that I hope you were able to hear in the audio is sort of the shock at the numbers that Ehrlichman gave to Nixon. When he says what, it was not just what, I didn't understand, it was some surprise or some very strong response. I think that gives you some idea of, while Nixon, you may recall earlier in our conversation, publicly was saying it's important for a health equity reason. Privately, he was saying population control is actually designed to potentially do something very different. But we don't even have to go to, again, reading between the lines of a report written in the 70s. We don't have to take a private conversation from the president and one of his policy advisors. There's the next quote I'm going to read for you comes from Justice Ruth Bader Ginsburg, an interview she did with the New York Times in 2009. Now, the journalist actually had asked Justice Ginsburg, what is it over the course of your career that you think we didn't get right or that we should do again? And this was a Justice Ginsburg response. Reproductive choice is to be straightened out. There will never be a woman of means without choice anymore. That just seems so obvious. The states that have changed their abortion laws before Roe to make abortion legal are not going to change back. So we have a policy that affects only poor women, and it can never be otherwise, and I don't know why this hasn't been said more often. This is health equity. She's very much describing the health equity of what was happening during Roe and why Roe was, people were, the justices were thinking with respect to Roe. And then Bazelon said, are you talking about the distances women have to travel because in parts of the country abortion is essentially unavailable because there are so few doctors and clinics that do the procedure, and also the lack of Medicaid for abortions for poor women? And Justice Ginsburg actually talks a little bit about some of the rulings that were occurring at the time. Yes, the ruling about that surprised me. And again, she's referring to a change or a judicial decision that was handed down in 1980. But frankly, I had thought at the time Roe was decided, there was concern about population growth, and particularly growth in populations that we don't want to have too many of. Now she's gone back to this notion that I'm describing, that population control was a very specific choice, and that at the time, while health equity was a common explanation and the one that you would hear today, that at the time many people understood the goal of some of these family planning programs and abortion policy to control the growth in populations, again, that in their language, that they don't want too many of. Again, my take on this is health equity, absolutely. A lot of people were in favor of health equity and these contraceptive policies as a result. But I think that history has sort of lost part of what was happening at the time, and that this was just following a eugenic period. This was a time when populations were surging, and many policymakers were intentionally saying we need to control populations, and populations we don't want too many of. I think that's an argument or a story that's been lost to the conversation, and an important one, because the program that we have today still does not have any infertility treatments. And that is, there are many potential explanations I talk about in the latter two-thirds of my book about why that may not have happened even to this day. But a lot of the source or the start was important to where we are in our family planning in the United States at this point in time. Now, the next thing that I wanted to spend a little bit of time talking about is what Americans think. What do Americans think about family planning programs? This is important not because the history, I think, is relevant and crucial for us to understand, but maybe people think differently today. What do people believe is the importance of using family planning programs as we move forward? So I commissioned YouGov. YouGov is an internet poll service that provides a lot of data, polling data across the United States, Europe, Asia, and the Middle East. There are over 1 million residents who can potentially respond to YouGov polls, and I asked YouGov, can you include a few additional questions in your weekly survey of Americans? Now, you're going to see results from 2 separate polls, both of them 1,000 people, both of them nationally representative, and they were both conducted in October of 2022. So the first question that I asked of 1,000 Americans was modeled on a question that the Kaiser Family Foundation asked in one of their surveys. As you may know, the federal government currently provides funding to clinics to help low-income women afford reproductive health care and preventive care services. How important, if at all, is it to you that the federal government provides funding for reproductive health services such as family planning and birth control for low-income women? Is it very important, somewhat important, not too important, or should it not be done? And this is the response that we received to that question. About half of Americans said this is very important to us. If you include the top 2 categories, nearly 3 in 4 Americans think that this is a good practice that the federal government provides contraceptive services. You can see some think that it's not very important, about 10%, another 10% think that it shouldn't be done, and around 8% think that, that they don't know. So again, the vast majority of people think this is a good policy, and it's not surprising. It's continued on and on as we move forward, that we continue to offer these family planning services. Now, if you look by ideology, it's quite interesting. The data show that if you classify yourself as very liberal, you tend to be incredibly, the vast majority of people who consider themselves very liberal are supportive of these policies, these contraceptive services. Liberals, it's quite high as you move across the political spectrum to those who are very conservative. You can see the very conservative group, it tends to be each category tends to have around the same number of people who are supportive. So this may be consistent with what many people would have expected. The more liberal you are, the more that you believe that the federal government providing contraceptive services is a good thing. Now, the other thing that I did in this survey was I asked people why they were supportive of, or why they made the response that they made. And I want to be very clear. The vast majority of people who were supportive of the current family planning program say something that we would call health equitable. Healthcare is a human right. I think the best way to improve a society is to increase the education level of its very young women. Women can stay in school longer if they aren't having to raise children, or if they can afford to maintain their health care. Again, the vast majority of people in the United States today who are supportive of this program offer a reason that we would say falls in the health equitable range. Now, I don't want to emphasize that there are a lot. There were not a lot, but there were some people who said that they're very supportive, a very small proportion, who offered what I would call mixed reasons. So they elaborated. They would say something that's health equitable, but they would also say something that's a little more in alignment with, we want to be a little bit concerned about offering, we want to potentially offer these things to keep some people from having too many children. So I'll read a couple of these. I think it's very important because without funding, it's impossible for low-income women to receive proper care that they need when they need it most. again, very health equitable. They will suffer in many ways, and that could possibly cost Americans more to fix it if it gets out of hand and they don't get the care that they need and the care and the help that they need. So again, health equitable, but starts to bleed into, but if they have children, then there could be some cost to society. Another respondent said, prior to my retirement in 29, I was a healthcare social service provider. I saw firsthand the need for long-acting reproductive contraceptives by low-income women. Having unwanted children would have wrecked many lives and created greater hardship for the state, which would have had to provide support for many of them. Prevention is always better, and this includes prevention of the need for abortions. That was another explanation that was sometimes offered. These services prevent abortions from occurring. So there's a lot of complexity here that you can see in response to the support that Americans have for these programs today. There was a very small number of people who offered what I would call a very eugenic take on why contraception is important. I want to be very clear, the vast majority offer health equitable reasons. A very small number said something that I would call eugenic, but there was some. My point is some of these ideas have never gone away. They may not be prevalent, but they do exist to some extent. It's almost a Band-Aid solution, but it gets to the start of other problems and helps those in difficult situations. If a low-income woman doesn't have access to health care and she gets pregnant and sick, it has the potential to create a never-ending cycle and ultimately burden the community. Another said, I think birth control is important for low-income families so they can stay off welfare. A third said, providing resources for lower-income women is an important step in stopping detrimental societal effects like crime. That's not too different from what you would have heard in that population stabilization period. The next thing that I did was I gave a second set of 1,000 people, nationally representative, a second question. And this was a question that I tried to match to the original question that I asked. And in this question, I wanted to ask about infertility treatments. So you'll notice that I tried to make these two quite very parallel. So in my case, I said, as you may know, in most areas, the government does not currently provide funding to clinics to help lower income women afford infertility treatments, such as hormones to stimulate ovulation or in vitro fertilization. How important, if at all, is it to you that government provides funding for lower income women who are having trouble becoming pregnant? Is it very important, somewhat important, not too important, or should it not be done? Again, same categories. And in this case, you can see there is about a quarter of people who would be in favor, who think this is very important, but that's much lower than the 48% we were seeing earlier. About a fourth, another quarter of them think that this is somewhat important. You have much higher responses among the not too important or should not be done relative to what we saw. If we put those back to back, you could see that the idea of offering infertility treatments is much less favorable. I think in some ways it's interesting that so many people do believe that these infertility treatments should be a component of family planning services, but it is clearly the case that it's not nearly as popular as the current program that exists. One of the last slides that I want to show, here you can see a difference by political ideology, and to me it was quite interesting. If you're on the conservative or very conservative part of the political ideology, you're not really seeing much of a difference in response in terms of favorability of the programs. If you were in favor of contraceptive services, you know, the level of being in favor of the infertility treatments seems roughly the same. So what you're looking at in this graph are the differences. So bars that are very close to that horizontal axis, that's a place where you don't see much of a difference in opinion between the current contraceptive program and one that would offer infertility services. Where you see huge differences in their support is among the very liberal and liberal individuals that we interviewed, where over 90% of people who were classifying themselves as very liberal were in favor of contraception. Much less than 50% of them are in favor of providing infertility treatments. Finally, I asked a number of people, I asked everyone who responded to the question, why did you respond the way that you did? And the most common answer for people who are not in favor of infertility services were things like, if you're a low-income individual, then they won't be able to afford to take care of their baby, and everyone will end up paying more. If you can't afford a baby, don't have a baby. I know this is a brutal take, but if a woman or family does not have the funds to explore infertility options to have children, they most likely cannot afford to properly raise children. There, again, this notion of providing infertility treatments, much less popular, and the most common explanation for not supporting them is government should not be providing services so that low-income individuals can have children, which is very different from what the definition of family planning means internationally. So what are the takeaways from my presentation? The first thing that I would argue is that while health equity was extraordinarily important to the justification why the family planning programs that we offer were so popular, I think that eugenics played a larger role than has been acknowledged up until now. And why is that important? That's back in our history. Well, of course, understanding our history matters so that we can understand what's happening today. Our current system, and in the book I make more arguments about this, doesn't include these infertility treatments as part of our family planning for low-income women. And part of that could simply be path dependence. It never was there. We reauthorized this legislation over and over again, and we never thought to bring it in. On the book, I also say that we shouldn't actually be focusing family planning just on low-income women anyway. We should be thinking about family planning more broadly for all women in the United States, all people who want to have children, and that it's not clear that creating a system that allows for infertility treatments or a fully complete family planning program would be any easier today. Perhaps it would, but it certainly doesn't have, my data suggest, nearly the support that you would see for the current family planning programs that we offer in the United States. As I go forward in the book, I talk about what actually exists in the United States. Is there more evidence about the way that people think? Then I talk about the future. What does the future hold for the United States as more and more technologies allow for people to design their babies? I think that there's a very important role that the government will play with family planning. And then the final thing that I do is offer a policy prescription that I believe can be one that allows us to have a family planning system that is the most equitable and the most fair, something I called wanting children. And that is very simply that our guiding principle when we create family planning policies is that we should try to help people who want to have children have them, and those who don't want to have children not to. Enjoy getting a chance to talk with you, and thanks very much.